welfare at Dongmyeong University in Busan, South Korea. Nice to meet you. Today, I would like to present a research paper I wrote in 2022 titled autoethnography on the development and counseling experience of a non-face-to-face mental health mobile service platform of mental health social welfare expert. The table of contents is as follows. First, there is a need for research. Recently, our society, especially South Korea, is developing further amid high economic growth and modernization and a flow of information and COVID. But mental health problems caused by various stress factors are further increasing socioeconomic costs. However, the rate of service use related to mental health in South Korea is still not high. This is thought to be due to misperception and prejudice, and lack of information provision and lack of knowledge about mental illnesses. Considering this Korean situation, it can be seen that changes to the existing mental health professional service delivery system and service provision platform are necessary in providing information and counseling services to promote mental health. An alternative that can be used in this situation is the use of a mobile service platform. In fact, there is a great demand for mobile-based mental health intervention, which are known to be suitable for enabling evidence-based mental health monitoring and self-management for mild, severe, or various mental health disorders. As a result of analyzing representative non-face-to-face mental health services in South Korea, they could be broadly divided into three types. One type is non-face-to-face counseling, and second type is simple viewing, which encourages users to take the lead in using contact without an expert. Last type is SNS type. These platforms are either created in the public sector or in the private sector and are commercialized. However, while numerous various applications for convenience of life have been developed and distributed, but there are relatively few applications aimed at providing mental health issues, services, and related studies are almost not existent, so there is a need for research on this. According to the need for such research, the purpose of this study are as follows. This study is as such, it is an autoethnography study that analyzed the actual experience of the development and operation of the Seoul Council, a mobile platform, which is developed and operated in the private sector by a researcher who is a mental health social welfare expert among various mobile mental health services platforms being commercialized in Korea. The purpose of this study is to develop a new mental health social welfare service platform that can be used in the mental health service delivery system for the mental health of modern people, and to explore the possibility of providing mental health services through mobile devices. This autoethnography is about mental health social welfare experts, development and counseling experiences of a non-face-to-face mental health mobile service platform. So introducing the researcher, it's me, the subject of research, and the mobile platform developed and operated by the researcher is important in autoethnography research. Accordingly, I would like to briefly introduce myself as this research's subject and then the reason for creating this mobile platform. This researcher, is me, has been working and having experience in counseling as a mental health social worker in the mental health services field in South Korea for 17 years. At a psychiatric hospital and an addiction treatment hospital. The reason why I developed the Soul Counsel mobile mental health counseling service platform are as follows. In the process of experiencing the provision of professional mental health service both online and offline, I felt the need for mobile device-based mental health services for clients who were in the blind spot of services. And above all, for response to the COVID pandemic, so I have become more convinced that the development of a mobile-based mental health professional service platform is necessary. Within this confidence, I developed a mobile app and mobile web and website-based mental health professionals service platform and commercialized it in June 2020. And although I am now working at a university as a professor, but I am still providing online counseling mainly through mobile platform, and I continue to provide face-to-face counseling mainly with the clients who came to me. I am also continuously conducting research on mental health counseling and digital treatment based on mobile platform. Another important background on which this study is based is Soul Counsel, an anonymous SNS-based mobile mental health professional counseling service platform. Accordingly, let me introduce the Soul Counsel platform itself is as follows. The Soul Counsel platform was developed by a research method in mental health social welfare in June 2020. This platform is an anonymous SNS-based mobile mental health counseling service platform that addresses comprehensive mental health issues that are not targeted at specific mental disorders. This platform is currently developed in a web-based hybrid form and can run on the mobile web and PC web and on Android app and on iPhone app. Have been developed so that they can be downloaded from each market and distributed and down worldwide through various mobile devices such as PC as well as smartphones. The services provided within this platform are largely bulletin board counseling services and chat counseling, as well as mental health-related self-examination checklist and provision of information on mental disorder, diagnosis criteria, and columns by mental health social welfare expert. In addition, based on this platform, if a client wants direct counseling in a form other than bulletin board counseling or chat counseling, service can be provided through phone counseling, video counseling, and face-to-face counseling. This study is a qualitative study using autoethnography research methodology. But for the sake of time, I will skip the detailed information on the research method. Types of autoethnography can be divided into 3 types: minority autoethnography and reflective of autoethnography and autobiographical of autoethnography. So this study can be seen that 3 types are mixed. Skip. I will skip. The results of this study are as follows. First, I started meeting by chance with numerous domestic and foreign people who requested counseling from me through a foreign language study app. And at their request, I started providing mobile-based online mental health counseling. I will skip the detailed information on the result. Second, problem of accessibility about meeting mental health experts and people seeking counseling non-face-to-face and anonymously. And with the onset of the COVID, I take on a new challenge. Skip. The third, I had a unique experience as a mental health social welfare expert in the process of developing a new concept, mental health specialized mobile service platform. Fourth, another clinical experience is on a new concept, mental health service mobile platform. I could have been born again a further expert in mental health social welfare through activities on mobile platform. Fifth, people in various life cycles sign up for this mobile service platform and begin to post about their worries. Six, awareing the need for mental health services provided both online and offline, I begin to try something new. Based on the 6 analysis results so far, the conclusion and recommendation of this study are as follows. First, among the Korean people, there are many people who are directly exposed to mental health related issues and need to receive professional medical services. And as well as there are also many people who don't require therapeutic intervention, but have a variety of service needs for mental health issues. However, despite of the fact that there were many people who have needs for various types and levels of mental health services, a significant number of people are often in the blind spot of services. Accordingly, it is necessary to do that. We have to try to diversify and diverse the functions of the mental health service delivery system, just not centered on existing medical institution or mental health welfare center. It will be necessary to minimize blind spots. To this end, creating and utilizing a variety of mobile-based professional mental health service platforms could be one way. However, these changes must be led by the state. Second, considering the characteristics of modern society, especially in the context of infectious disease pandemic such as COVID, the public is increasing in preference for various mental health service platforms using mobile devices. In other words, although many people are directly exposed to mental health related issues or have a desire for services, access to mental health services is low. And on the other hand, the tendency that they can be feeling less psychological burden by receiving services anonymously and rather than they are prepared to access such mental health services is higher. Accordingly, there is a need to create a more diverse mobile mental health service platform, and to this end, the government should have to provide policy support and management. Third, when analyzing the mental health issues on this mobile platform, there are common issues that appear. There were many mental health related issues arising from family, stress, interpersonal relationships, and occupation, and which were similar problems complained about by all generations. In particular, it was found that these problems were associated with psychopathology such as depression, anxiety, addiction, and PTSD, and also were mentioned together with a significantly high frequency with other mental health problems such as self-harm and suicide thoughts. Accordingly, it is necessary to ensure that the general public is continuously exposed to various mental health education and services for mental health promotion at a preventive level. To this end, based on community mental health welfare centers, which currently play a key role in Korea's mental health service delivery system. Mental health promotion projects for the general public should have to more activated to prevent commonly mental health issues from developing into mental disorders. For this, it would be necessary to make preventive preventions more active to prevent this from happening. Fourth, adolescents are exposed to very serious mental health related problems, in particular by school-aged teenagers. So it was in the, they complained of difficulties similar to those of adults with differences in content and degree. Above all, there were a lot of contents related to self-harm and suicidal thoughts, which shows that a significant number of adolescents are already exposed to serious mental health issues that we may not have thought about. So it is necessary to ensure that a total census inspection surveys and monitorings are conducted more actively at the national level, focusing on issues related to mental health of adolescents, and it is necessary to reorganize the mental health service delivery system for children and adolescents. Fifth, the method of providing professional services online through mobile devices and the method of providing services offline may be different due to the characteristic of the platform itself. Accordingly, multifunctional mental health professionals who can provide professional mental health services in various forms in various services delivery systems are needed. In this study, actually a significant number of mental health social workers were generally accustomed to offline intervention, and most had never been trained or had no intervention experience in online intervention methods such as bulletin board counseling or chat counseling. So they complained of difficulties in working as an expert within mobile devices. So to this end, educational curriculums on providing professional services online through various mobile platforms must have to be added to the undergraduate curriculum for mental health professionals. Yes. Reference. And thank you so much for listening to my long presentation. Thank you. There was a delay and I am not good at English, so if you have any question about my research or would you like further communication, please contact me at the email. Thank you so much.
Thank you so much, Doctor. That was an excellent presentation.
Conference about urban community welfare, the effect of air pollution on the psychological well-being of urban community. So if you are talking about the background of this research, first let's discuss about the very important aspect here. It's about the population. In 2020, 57% of Indonesian population live in urban area. Based on prediction from Indonesian Central of Bureau Statistic, this percentage is expected to increase to 66.6% by 2035. Now, is the population growth is a good thing? Of course, it's a good thing. It can bring a lot of benefit, but such as economic growth and development, the higher population in urban area will also face several challenges like the limited land for housing, make it harder to build some sufficient living space, and a higher spreading infection disease due to crowded condition. And the last one is the increasing in the number of vehicles in the road, leading to more traffic and pollution. The rise of vehicle usage, also household waste, and other activity directly contribute to air pollution. More people mean more pollution. Why? This issue worsened with additional source pollution like cigarette smoke. Indonesia is also known have a lot of cigarette smoker, and also open waste burning, which significantly impact on public health. This challenge highlight the importance of addressing air pollution, especially in urban area where population growth faster. Okay, second, we are talking about the air pollution itself. Air pollution usually comes from gases released into the air. The gases are produced by things like factory and household waste and vehicle, cigarette smoke, burning tasks, and others. Air pollution has many forms, but when the pollution is combined, they create some called as particulate matter, or we can call it next as PM. I'm sorry. PM consists of tiny particle measured in micrometer, and it's so small that you can see with a naked eye. So one type of PM is the PM10. PM10 is about 10 micrometer in size. There is, you can analogically with a strain of hair, you can compare it, the PM10 with a strain of hair. But we there have the even smaller particulate is called the PM 2.5 micrometer or PM 2.5. The tiny size of PM 2.5, it's much more dangerous. Why? Because when we breathe the polluted air, this tiny particle can enter our lungs and even our bloodstream. This can cause some serious health problems, especially for the lungs, because the body can easily filtering out something that's small like that. Over time, it can lead the respiratory issue, other long-term health risks. This is why PM 2.5 is considered one of the most harmful types of air pollution, and why reducing air pollution is so important for public health. Several studies have shown that air pollution is still relevant in developing country, and Indonesia one of the developing country, right? The negative, why does this happen? Because most of developing country still rely on industry that produce a lot of air pollution and not haven't yet adopted green industrial practice. The impact of air pollution doesn't just affect physical health, it can also harm the mental health of people living in the polluted area. This is especially true for those in living in industrial city like Jakarta and Bekasi, where there's heavy vehicle activity and air pollution from industrial waste. The third one, we are talking about the previous study showed air pollution in urban area can have several negative effects, like it can lead to decrease of life satisfaction, increasing level of distress, and also lower productivity. Additionally, it raises the risk of mental health issue like anxiety and also stress. In more several cases, long-term exposure of air pollution can even contribute to development of chronic mental health condition, because neuro problems here in the brain, the PM 2.5, it can also impact on the brain also. The highlight of air pollution doesn't just harm physical health, but it also have a significant impact on psychological well-being, especially for those living in urban environments. So Here's the research method. I'm using participant taken from various cities in Indonesia, but I only managed to get to collection from Semarang, Jakarta, and Bekasi. The questionnaire used in this study is based off RAVE psychological wellbeing, and it have six aspects like self-acceptance, positive relation, autonomy, environmental mastery, and purpose in life. And I translate to Indonesia, and it's also already translated by Rafaelia, and resulting in 37 valid items to measure the air pollution, the air quality. I'm using IQAir website, index quality air. You can search it in the website, and it's provide air quality data from various location and present the average of the pollution. So to analyze the significant relationship, I'm using linear regression to determine there is significant relationship between air pollution and psychological well-being. So first one, we are talking about the result of IQAir data. IQAir is mean index quality air, and the table one in the right one in my screen. Table one is show the air quality data measured on over 37 days. The data is considered normal because the significant value is about 0.05. The IQAir table provide and the left one is the IQAir table, and it's provide the air quality level ranging to good and to hazardous. And if you can see, Bekasi and Jakarta have unhealthy for sensitive group, and Semarang is the moderate. And Bekasi and Jakarta is also known as the most crowded city in Indonesia. Bekasi have a lot of industrial area. I'm also live in Jakarta, and I know Jakarta is very crowded city. Bekasi and also have a lot of big vehicle like container and etc. like that. So, okay, we are talking about the linear regression here. The result of analysis indicate there is no statistically significant relationship between air pollution and psychological well-being. This means that the data does not provide strong enough evidence to confirm that air pollution directly impact on psychological well-being as a whole. However, when we look closer at specific aspects like the personal growth aspect, the PG I'm using more simple PG or personal growth aspect show a significant value that is relatively close to being statistically significant. This suggests the air pollution might have even slight tendency to influence this particular aspect, even though it doesn't meet the threshold for statistically significance. And moreover, when we analyze the relationship map, the blue one, you can see there is the personal growth in Semarang is show a stronger tendency towards significant compared to other city. In Bekasi and Jakarta, it also have a similar pattern, are observed indicating weaker tendency towards significant. This finding highlight the possibility that while air pollution may have a strong impact overall, certain aspect of psychological well-being, such as personal growth, might still but subtly influence in specific urban setting. However, further research with larger sample and more focused approach will be need to explore these tendencies in greater depth. Yeah. So the conclusion about my research is the result of this study indicate there is no statistically significant relationship between air pollution and psychological well-being. However, there is no possibility that a larger sample size could reveal the turn toward significance. Additionally, the researcher found several significance studies that also reported no significant relationship between air pollution and psychological well-being. On the other hand, many studies have demonstrated a clear connection between the air pollution and psychological well-being. If I'm talking about the limitation of my research, is the small number participation in this study, and also I'm not doing it I also recommend to doing this research in just one city, like in Bekasi or in the Jakarta, or maybe in your own city, because the more focused area, you can also have a lot of participant and also have a lot of just have one city can impact to your research. So to future study should include more detailed demographic data such as income level, gender, and age to explore how this variable also may influence the result. Finally, future research could focus to conducting a more depth analysis in the single city to reduce variability and produce more focused findings here. So that's all about my presentation. But this research is remind us that even tough, the impact of air pollution may not always immediately visible. Efforts to protect the environment must remain a priority. After all, this planet is the only home we all share. Thank you for hearing my presentation. I apologize for my bad English. Thank you.
Thank you so much for the wonderful presentation. If anyone has any questions, please.
First of all, I would like to extend my warmest congratulations to the Scientix conferences for organizing the 4th International Conference on Psychology and Mental Health. This gathering will represent a significant opportunity for professionals from diverse backgrounds around the globe. Today, I will share the findings of our study that was conducted by myself, Dr. Rabia Mushtaq, and Ms. Amna Abdul Ghafoor, who is the PhD scholar at the Institute of Clinical Psychology, University of Karachi. The topic of our presentation is exploring the role of resilience as a mediator in the relationship between infertility, stress, and marital satisfaction in married couples with infertility. If we talk about the background, infertility is considered as a global issue and has a profound impact on married couples, affecting various aspects of their relationship, emotional well-being, and quality of life. Infertility poses a significant health challenge as defined by the World Health Organization as the failure to conceive after a year or more of unprotected intercourse. WHO estimates that 10 to 15% of couples globally experience infertility, with rates varying across regions, among which developing countries face a higher incidence of infertility due to limited knowledge about its causes and available treatment approaches. In Pakistan, for instance, the prevalence of infertility stands at 22%, with primary infertility affecting 4% of those affected. Due to infertility, both partners may grapple with feeling of sadness, grief, anger, frustration, guilt, and even shame. There may be a sense of inadequacy or loss, particularly if they had envisioned having biological children. It can also profoundly affect the marital satisfaction of couples with infertility. Marital satisfaction is an individual psychological state that reflects a marriage in terms of perceived benefits and costs. The higher the cost, the lower the satisfaction with marriage and partner, and the higher the perceived benefit, the higher the satisfaction with marriage and life partner. Marital satisfaction becomes important when different aspects affect couples' relationship, and infertility has been found as one of the factors that may affect the quality of their relationship. It has found that increase in stress results from infertility may cause problems in the relationship of couples and reduce marital satisfaction. Among various factors, resilience serves as a coping resource and can efficiently manage psychological stress. Resilience is the capacity to bounce back from past difficulties, failure, disappointment, or even positive occurrences. Resilience has been defined as the psychological capacity of an individual to resist and adjust to challenging life experiences. It entails an ongoing process of skillful coping in the presence of substantial adversity. As a result, it might be considered as positive counterpart to vulnerability. Marriage has lots of ups and downs, like any other relationship. Couples who are better able to adapt in the adversity may have lifelong and healthy bond. The resilient couple will use better coping mechanism to deal with their stressors such as infertility. Resilient individuals consider adversity as part of their learning and growth, as they possess characteristics like optimism, positive attitude, and regulation of emotions. It has been found that marital resilience has a positive impact on a relationship by increasing marital satisfaction. The objective of the present study was to investigate whether resilience mediated the association of infertility-related stress with marital satisfaction in married couples with infertility. After the thorough literature review, it was hypothesized that resilience would play a mediating role in the association between infertility-related stress and marital satisfaction in married couples with infertility. This study was conducted in Karachi, Pakistan, from September to December 2023, and the sample was consisted of 40 married couples, including 40 husbands and 40 wives, with the age range between 20 to 40 years, they were selected from the gynecology and obstetrician department of various hospitals and infertility clinics situated in Karachi, Pakistan, by using purposive sampling technique. Here is the inclusion and exclusion criteria. In this study, only the cases diagnosed with primary infertility who did not initiate IVF treatment at the time of data collection. Their age was ranged between 20 to 40 years. And most importantly, their minimum education level was grade 10, so they can better understand the questions before rating them. The couples living together, couples who gave the consent for their voluntarily participation, and only Pakistani nationals were the part of this study. Before administering the questionnaires, brief interviews of the participants were conducted to determine the eligibility criteria. And then Urdu versions of the infertility-related stress scale, the resilience scale, and enriched marital satisfaction scales were administered along with a demographic information form. Urdu is the national language of Pakistan. Before conducting the study, it was approved by the Ethical Review Board of the Institute of Clinical Psychology, University of Karachi. Only standardized tools were used in the national language of Pakistan after taking consent from both from original authors and the ones who adapted the original scales in Urdu language. Consent from the participants were taken for their voluntarily participation. They were assured for the confidentiality of the data, and they were also assured of no harm of physical or psychological nature associated with this study. Participants was given the right to withdraw at any stage of the study, and individual counseling was provided by the researcher for those who were in distress at the time of data collection. Here is the table 1 representing demographic characteristics of the participants of this study. You can see the percentages related to the gender, the education of the participants, the occupation of the participants, and duration of marriage. Table 2 represent the summary of mediation effect of resilience between infertility, stress, and marital satisfaction. Here is the summary. And the conclusion highlights that the resilience mediates the link between infertility, stress, and marital satisfaction, which significantly impacts individuals coping with fertility difficulties. Here are the few implications of the study. These findings would support understanding the role of resilience and inform the development of targeted interventions to enhance resilience in couples facing infertility issues or fertility challenges. This study will also help offering compassionate and efficient care, devising personalized interventions and support programs for couples encountering fertility issues, and offering guidance to hospitals and infertility clinics in formulating pertinent policies and support initiatives for this population. Psychological interventions aimed at enhancing resilience could be incorporated into fertility treatment programs, and support groups and counseling sessions could emphasize strategies to improve resilience, helping individuals better manage infertility-related issues. There are a few references of the literature we used in this presentation. Thank you so much.
And behavioral planning deficiencies in South African primary school children. So in my introduction, I can just say attention deficit hyperactivity disorder, ADHD. It's a common heterogeneous neurodevelopmental disorder of genetic origin with a childhood onset and which often persists into adulthood. And according to the Diagnostic and Statistic Manual of Mental Disorders, 5th edition, DSM-5, ADHD is characterized by symptoms of overactivity, impulsivity, and inattention, which are presently regarded as the main clinical symptoms. And globally, the prevalence of ADHD does not significantly differ between America, Australia, and Africa. The prevalence of ADHD in children and adolescents worldwide is estimated to be 5.3%. In South Africa, Meyer et al. 2004 found that the prevalence of ADHD among primary school children of all ethnic population in the Limpopo province to be 5.5. The background, ADHD is defined as a cognitive and behavioral disorder, as I've indicated, and these symptoms may occur together or separately, resulting in 3 recognized presentations. The first presentation is the predominantly inattentive. The second one is the predominantly hyperactivity, impulsivity, and the combined presentation. So my aim of study, this study investigated deficiencies in behavioral planning in South African primary school children with and without ADHD. And the method that I've used in this study, the study was conducted in primary schools, as I've already indicated, in the Tzaneen area, Limpopo province, during 2017, a quantitative cross-sectional case control study and experimental design was used to establish whether children with ADHD are deficient in behavior planning. And the sample was divided into participants with ADHD matched with controls children without symptoms of ADHD. A total of 156 children, 78 with ADHD and 78 matched with control without ADHD of both genders, who were medication naive and aged 6 to 5 years participated in the study. The performance of the two groups was compared on a test of planning and problem solving. The Tower of London tall tasks were used, and the results were analyzed as a function of gender, age, and ADHD presentation. So the statistical analysis that was used during the study or before the statistical analysis, as I've indicated, the data collection was collected in Zanini. The instruments that were used were disruptive behavior disorder rating scale, which is a DBD, and this DBD was used to screen for ADHD symptoms, which was completed by parents and teachers. And the scale was standardized and normed for all language and population groups in Limpopo, South Africa. The DBD assesses the presence and the degree of ADHD-related symptoms in attention, hyperactivity and impulsivity, oppositional defiant disorder, ODD, and conduct disorder as formulated in the DSM-5. The DBD has been translated into 5 South African languages by Meyer et al. 2004, namely Xitsonga, Sepedi, Tshivenda, Afrikaans, and Tsonga and Tswana, which are spoken in the Limpopo province. Internal consistency and norms for each group have been established. And the assessment of behavior planning, as I've already indicated, I have used the Tower of London test. TOL is a widely used instrument for assessing planning ability. So when I used this tool, I wanted to assess the higher order problem solving capacity, specifically executive planning of children with ADHD. So the statistical analysis of variance ANOVA was used to investigate possible between group differences using the TOL raw score. And the analysis was done using the statistical 10 StarSoft 2011. The results for each test were analyzed with 4x2 ADHD presentation and gender, and ANOVA for independent sample, and post-hoc test consisted of multiple comparison using the Bonferroni. So I struggled to share with you the tables, but I can try to share. I don't know whether I will be able to do that, to share with you the tables, or you can share with the listeners or my tables. I don't know whether you can be able to share with them. Hello? Hello?
Hello.
Can you share my tables?
Can I share your what? Sorry.
My tables, my results tables.